Good evening. My name is NSTD Nurska McKinney, and I will be performing the head neck assessment. Okay, so this is my patient Nikita St. Luke who's going to assist me with the assessment. Okay, so always remember that you are required to always perform your health medical hand washing technique. Okay, so always to introduce yourself to the patient and explain to them what procedure you will be performing. Okay, good afternoon, Mr. St. Luke. How are you?
I'm good, and you?
That's good. My name is NSTD Nurska McKinney, and I will be performing the head neck assessment, okay?
No problem.
Okay, so first of all, what I'm about to do is check his hair for any lice or any alopecia. No dandruff, everything is clean and normal. And now I'm going to check his face. Okay, so there's no lumps, no lesions. Skin is smooth and hydrated and moist. So now I'm going to check for his sinuses from here to here. I'm going to palpate. Any pain?
No, ma'am.
Any pain?
No, ma'am.
Okay. So now I am going to check to see if his nose is midline. All right, his nose is midline to his face. Very, very good. And I'm also going to check again for his eyes to see if he has any eye swelling or jaundice or any infection under the eye. No jungler. The sclera is white. So I also have to check also for his pupil to make sure that his pupil is intact. But unfortunately, I don't have a light, so we cannot check that. But I'm going to use this comb to make sure that his eyes will follow. Don't move your head. Okay, eyes are fully and functional. Okay, so now I'm going to palpate for his ears. I'm going to check to see if I'm going to check his mastoid. There's no swelling. There's no redness. Everything is normal. And I'm going to pill to see if there's no tupia. And normally what we do is check inside the ear to make sure that everything is normal and that the light is at 5 o'clock. So apparently I don't have any stethoscope. I mean the light. But it appears that everything is normal. Any pain?
No, ma'am.
Okay. So now also what I want you to do is move your head up and down, side to side, turn left, right. Okay. Any pain or anything?
No, ma'am.
Okay. So now I'm going to check for inside of his mouth. Okay, can you launch your tongue? Okay, so the tongue is always supposed to be moist and hydrated and pink. Can you lift up your tongue? There's no lesion, no bumps, but he has cavities in the teeth. There's no swelling or anything. There's no thrush. Okay, close your mouth. Okay, so now I'm gonna check his trachea. Can you lift up in there? His trachea is midline. No lesion, no swelling. Okay, you can put it down. And I'm gonna give him something to smell to see if his olfactory nerve is fully functioning. So can you close your eyes? Can you tell me what you smell?
Joy.
Okay. Okay, so his olfactory nerve is fully in function. So now we're going to check his nose to see that he has full airway, fully no blockage of mucus or anything. So can you close one your nose and breathe in and breathe out? Okay, fully airflow, full airflow. Okay, full airflow. And now I'm going to check up in his nose. Can you raise your head up? Okay. No blockage, no mucus, no lesions, no redness, no swellings. Everything intact. Okay. And now what I'm going to do is that I'm going to check to see if his cranial nerve 8 is working for his ears. So tell me if you can hear me.
Yeah.
Sorry. What did I say?
Top out.
Okay.
8.
Okay. So his cranial nerves are fully intact. He can hear on both sides. Okay, so now I'm going to check for his temporal. Any pain?
No, ma'am.
There's no swelling, no lumps. And then I'm going to check for his jugular process. Any pain?
No, ma'am.
No swelling. Everything is intact. And now I'm going to inspect his neck. Okay, so can you turn your head to the right? To your left? Okay. There's no sign of jungular veins. Everything is smooth. No lesions. Okay, so now I'm going to check the mastoid process. Any pain?
No, ma'am.
And then I'm going to move down. Any pain?
No, ma'am.
I'm going to check for the clavicles. Any pain?
No, ma'am.
Erase your hair. Any pain?
No, ma'am.
Okay. No pain. Okay, so whenever they have facial bears like this too as well, you also check. Everything appears to be clean, nicely groomed. Okay, so now again let me double check for his pupil. Can you open your eyes? So his pupil is constricted at 2+. sorry, not his pupil. His pupil is normal. It always should, the pupil range should always be from 3 to 5. So now I'm going to listen to the airways of his neck. Can you bring that? All right, so airway is normal of 2 plus. Good job. And that is my head neck assessment. Thank you.